Hi, everyone. Welcome to week number 6. And this week we are looking at a couple of things, largely connective tissue. We'll dive a little bit into the muscular and nervous tissue. We'll talk about the structure and function of membranes and a little bit with respect to tissue repair. So let's start with connective tissue. There are some general features with respect to connective tissue. It is the most abundant and widely distributed tissue in the body itself. It consists of two basic elements, cells and extracellular matrix. And extracellular matrix is formed from ground substance and fibers. Matrix is abundant, has relatively few cells, and it tends to prevent tissue cells from touching one another. So it provides a medium, I guess, is the best way to think about it. And speaking of that, the matrix can be fluid, it can be semi-fluid, it can be gelatinous, fibrous, or calcified. And it's interesting because sometimes there's some research suggesting, for example, that fascial restrictions might actually be due to changes in the extracellular matrix. With respect to the matrix itself, it is usually secreted by the connective tissue cells and neighboring cells, and that kind of determines the quality of the tissue itself. So last week we looked at epithelia, and to contrast connective tissue with epithelia, connective tissue does not occur in free surfaces. Connective tissue is also highly vascular and has a nerve supply, with the exception of tendons and cartilage. And that's important for us as RMTs when we're actually dealing with clients that had, say, a tendinopathy, or perhaps they've had some sort of damage to the cartilage in the knee, for example. We know, because of the nature of these structures, that it's going to take a little bit longer for people to recover from that. This is a really good image. I've actually included this in the worksheet for this week. Just an FYI, the worksheet for this week is not part of an open book assessment, but I put it up just in case you like to kind of work through some of the content in a way which involves kind of writing things out. Anyhow, so cells in connective tissue are derived from mesenchyme. Immature cells have names that end in blast. So, for example, fibroblast, as you can see at the top here, chondroblast. Mature cells have names that end in cyte. So, for example, an osteocyte or a plasmacyte. Most mature cells have reduced capacity for cell division and matrix formation, and most are involved in maintaining the matrix itself. So again, this is a really good image. I would be familiar with the various cells making up the connective tissue. So for example, fibroblasts, for example, will secrete fibers and matrix. Macrophages will develop from monocytes, and they have a phagocytic capability. And we talked about phagocytosis earlier in the semester. So there's an immune response here. Plasma cells develop into antibody-producing B lymphocytes. So again, there's an immune function there, as there is with mast cells, which produce histamine, which is an important element when we have inflammation. It's the body's response. So have a look at all the various elements in the connective tissue cells and be comfortable with understanding which each and every one of them do. So again, just to recap, extracellular matrix is located in the space between connective tissue cells and is composed of fibers and ground substance. Substances found in ground substance include things like hyaluronic acid and some sulfates. And the function of ground substance is that it supports, it binds, and it provides a medium for exchanging materials between the blood and cells. So it has a really important role with respect to having an indirect effect on cell function. We know there's a number of different fibers that are involved with the matrix itself. 3 types, in fact, are embedded in the matrix between the cells. Collagen fibers are comprised of the protein collagen. They're very tough and resistant to stretching. They do allow some flexibility in tissue, and they can be found in things like bone, cartilage, tendons, and ligaments. Elastin fibers are made from the protein elastin, and they provide strength and stretching capacity. They're found in things like skin, or blood vessels, or even the lungs. Reticular fibers consist of collagen and glycoproteins, and they provide support in the walls of blood vessels, and they form a strong supporting network around different cells. Cells like fat cells, nerve fibers, also skeletal and smooth muscle. Now, we can classify connective tissue in a number of different ways. We can talk about its embryonic elements. So connective tissue that is present primarily in the embryo or fetus is called embryonic connective tissue. Mesenchyme, found almost exclusively in the embryo, is a tissue form from which all other connective tissue eventually arises. This is referenced in table 4.3 in the text. Mucoid connective tissue, also known as Wharton's jelly, is found in the umbilical cord of the fetus. Another way to kind of think about connective tissue is to think about, again, a little bit more of its structural kind of makeup. So if we start here and look at loose connective tissue consists of all three types of fibers, several types of cells, and a semi-fluid ground substance. The ground substance aids in the passage of nutrients from the blood vessels of the connective tissue into neighboring cells and tissues. And it's found in many locations, for example, the subcutaneous layer of the skin. Adipose tissue consists of adipocytes, which are specialized. They store triglycerides, for example, and that's of interest to us as well. Dense connective tissue contains more numerous, thicker, and denser fibers, but considerably fewer cells than loose connective tissue. Dense regular connective tissue consists of bundles of collagen fibers in a regular and ordered parallel arrangement, and that order actually provides a lot of strength along the long axes of the fibers themselves. Dense, irregular connective tissue contains collagen fibers that are irregularly arranged, and it's found in parts of the body where tensions are exerted in various directions. It usually occurs in sheets, such as the dermis of the skin. It's also found in heart valves, the tissue surrounding cartilage, and the periosteum, which is the surrounding connective tissue around bone. Elastic connective tissue consists of elastic fibers and fibroblasts, and it's quite strong, and it can recoil back to its original shape after being stretched. It can be found in lung tissue and elastic arteries. Cartilage consists of a dense network of collagen fibers and elastin fibers embedded in sulfates, and its strength is due to the collagen fibers themselves. Unlike other connective tissue, cartilage has no blood vessels or nerves except in the perichondrium, so again, the surrounding tissue. And again, that's important for us in terms of healing. There are three major types of cartilage. Hyaline cartilage is the most abundant, but it's the weakest type of cartilage, and it's has fine collagen fibers embedded in a gel-type matrix. Now, because of its makeup, it provides flexibility and support, and it helps to reduce friction and absorb shock. So again, I would refer you to table 4.6. Fibrous cartilage contains bundles of collagen fibers in its matrix. It combines strength and rigidity, and it's the strongest of the three types of cartilage. Elastic cartilage contains a network of elastic fibers that would be described as thread-like. It provides strength and elasticity and maintains the shape of certain organs. So the growth of cartilage is accomplished by interstitial growth and oppositional growth. So basically growth from within and growth at the outer surface. Bone, also known as osseous tissue, consists of a matrix containing mineral salts and collagenous fibers and cells called osteocytes. Bone is classified as either compact or spongy, depending on how the matrix and the cells are organized. The basic unit of compact bone is the ostean or Haversian system, and it consists of 4 parts. Lacuna are small spaces between lamella and contain mature bone cells called osteocytes. Canaliculi are little canals containing processes of osteocytes that process routes of nutrient and waste transport. A central Haversian canal, which contains blood vessels and nerves. In spongy bone, the trabeculi are a little bit more pronounced. Now, bone supports, protects, it helps provide movement, it stores minerals, and it houses blood-forming tissue. So it has some very important roles. Once again, it supports, it protects, it helps provide movement, it stores minerals, and it houses some very important blood-forming tissue. Liquid connective tissue consists of a liquid matrix called plasma and formed elements. And those formed elements include things like erythrocytes, leukocytes, and thrombocytes. Erythrocytes are what we commonly refer to as red blood cells, and they function mainly in transporting respiratory gases. Leukocytes are white blood cells and are involved in phagocytosis, immunity, and allergic reactions. And thrombocytes or platelets function mainly in blood clotting. Another type of connective tissue, liquid connective tissue to mention, is lymph. And lymph is interstitial fluid flowing in lymph vessels. And of interest to us as massage therapists is a particular type of work that can be done by us called lymphatic drainage. For those, again, that like to kind of interact with visuals, I draw your attention to this link, which can be found in the static image. So again, this is a very good table to have in your knowledge base, if you will. So again, being comfortable with the nature of hyaline cartilage. Again, it contains a gel, and it appears as a bluish white type of. It has a bluish white type of hue to it. It's most abundant cartilage in the body, and you'll find it at different areas, at the ends of long bones, at the front or anterior aspects of the ribs, in the nose. That little wiggly part in your nose is primarily hyaline. Parts of the larynx and trachea. Also of note, the embryo and the fetal skeleton has a good portion of hyaline cartilage as well. So again, in terms of function, hyaline cartilage provides good smooth surfaces for movement of joints, flexibility, and support. It is the weakest type of cartilage, and so it's somewhat fragile as well. Moving on from hyaline cartilage, we get to fibrous cartilage. And areas where you'd find this, the pubic symphysis in our intervertebral discs, in the menisci of knees, portions of tendons that insert into cartilage. So it has a big amount of strength and rigidity to it, and that's really important. It supports and puts structures together, and the strength and rigidity really make it the strongest type of cartilage. In our practices, sometimes what we see are people that have had meniscal injuries. So again, being able to work with our clients is an important aspect of that. And some later programs, you'll look at assessing and treating meniscal injuries, as well as some other injuries in and around the knee. Elastic cartilage, you'll find at the top of the larynx. It's part of the external ear, also in eustachian tubes. It provides strength and elasticity, and it maintains shape, which is kind of useful as well. With respect to bone, here we see some blow-ups showing the osteons of a femur on the left-hand side, and you can see the structure involved here. You can see the lacuna and the central canal, and the caniculi and the bony lamella. So again, just to recap, the lamella are concentric rings of matrix. They're made up of mineral salts, and they really give the hardness to the bone. Lacunae are small spaces between and that contain mature bone cells, and of course those mature bone cells are called osteocytes. Caniculi, actually you can see them here, are little canals, and again they contain processes of osteocytes, and they allow for nutrient and waste transport. The big canal in the middle, and the central canal, is also known as the Haversian canal. It contains blood vessels and nerves. Spongy bone has trabeculae rather than osteons. And again, bone has some very important roles. It supports, it protects, it allows for storage, it allows for some blood-forming tissues to be formed. They serve as attachment points for muscle and serve as levers as well. And here we see the table for blood. So you'll find blood, of course, in a number of different areas. Here again, red blood cells, erythrocytes, white blood cells, leukocytes, and thrombocytes are platelets. Red blood cells have a role with exchange of respiratory gases. White blood cells have that role in immune function, and platelets allow for clotting. Within blood vessels is where you particularly find them within chambers of the heart. And in terms of functions, they're laid out here as I discussed as well. And you can see the different shapes involved in the various cells as well. So that brings us to membranes. And membranes are pretty interesting kind of parts of the body as well. In general, membranes are flat sheets of pliable tissue that cover or line part of the body. Epithelial membranes consist of an epithelial layer and an underlying connective tissue layer, and include mucous membranes, serous membranes, and the cutaneous membrane of the skin. Synovial membranes line joints and contain only connective tissue. So here we can see two different iterations of membranes. On the left, or the uppermost rather, we have the presentation of mucous membranes in the small intestine. Conversely, below that we have serous membranes of the lung with the different layers. And again, that kind of connection between the connective tissue and the membrane itself is of note. The epithelial layer of a mucous membrane is an important aspect of the body's defensive mechanism. It acts as a barrier to different types of pathogens, and it traps particles. The connective tissue layer of a mucous membrane is called the lamina propria. Serous membrane line the body cavities, as I mentioned, and they don't openly connect with the exterior. They cover the organs and lie within cavities. Some examples of this type of membrane include the pleura, which surrounds the lungs, the pericardium, which surrounds the heart, and the peritoneum, which you'll find within the gastrointestinal cavity. Membranes consist of parietal and visceral portions. And it's interesting, the epithelial layer secretes a lubricating fluid that reduces friction between organs and the walls. Sometimes people run into health problems when that ability for friction reduction is reduced. Here we see membranes in other parts of the body. So for example, in the skin, skin covers the body, and that's an important role. We can see it as part of a synovial membrane. And again, that's quite important as well. So if you look at the top, the skin has two layers, superficial epidermis and a deeper dermis. The epidermis consists of keratinized, stratified squamous epithelium. So we talked about that last week. And the dermis consists of areolar, adipose, and dense irregular connective tissue. Synovial membranes line joint cavities, bursae, and tendon sheaths, and they do not contain epithelium. And again, they secrete a synovial fluid. And the joints really need that synovial fluid in order to actually respond well to the jobs that they're tasked with. One of the things we can do as massage therapists is actually mobilize joints. And when we do that, what we're actually doing is we're applying what's called a succussive effect on the joint itself. So if we talk about muscle tissue, there's a number of different things to kind of consider. Muscle tissue consists of fibers that are modified for contraction, and they provide motion, maintenance of posture, and they also produce heat. They can be divided into three different types. Skeletal muscle tissue attaches to bones. When you look at skeletal muscle, it's striated, so you can actually see different types of fibers within it, and it's voluntary for the most part. So what that means is there has to be a conscious effort to kind of move it. Cardiac muscle is formed in the heart, It is striated like skeletal muscle, but it's involuntary, so we don't actually consciously think about having to pump or hurt muscles. Smooth or visceral muscle tissue is found in the walls of internal structures like blood vessels and viscera. It's non-striated. It is usually involuntary, and it provides motion. So things like it will constrict blood vessels, has a role in the airway. It will push food through the gastrointestinal system, and it will do things like contract the bladder if we need to kind of void. So really kind of important kind of roles there. Here is a link to an animation for looking at muscle tissue. Again, you can find this in the static area. And again, a really good table to kind of be familiar with. You can see the striations in the skeletal muscle here. Again, long cylindrical striated fibers. They will vary in length from a few centimeters to quite long strands. It can be described as roughly cylindrical with multinucleated cells. And again, it's voluntary because it can be made to contract or relax based on our thinking about it. It is attached to bones by tendons. And again, skeletal muscle has an important role with respect to movement, posture, heat production, and protection. Contrast that with cardiac muscle, and what we find is a little bit of a different kind of makeup to this tissue. It is branched, it is striated like skeletal muscle. It attaches end to end by thickenings of the plasma membrane. The desmosomes, which we talked about last week, strengthen the tissue and hold the fibers together. And if you think about the role of gap junctions, they need to be quite strong in what they're doing there. Gap junctions provide some quick conduction as well, so they serve that role of conduction, which of course you would need from one set of cells to another within the heart itself. Of note, it's an involuntary type of control that's taking place. Again, you find these in the heart wall, and the cardiac muscle tissue pumps blood to all parts of the body, so a very important kind of role. Next up, we have smooth muscle tissue. So as you can see in the image at the bottom part of this slide, it kind of surrounds blood vessels. It is non-striated, hence that's why it's referred to as smooth. The gap junctions themselves contain many individual fibers. It is largely involuntary in nature, and it can produce very strong contractions in a unified type of manner. Of note here, where gap junctions are absent, such as the iris of the eye, smooth muscle fibers contract individually, like skeletal muscle fibers. So it becomes somewhat specialized in those areas. Where would you find smooth muscle tissue? Well, as mentioned, in the iris of the eyes, in the walls of internal structures like blood vessels, in the airways to lungs, stomach, intestines, gallbladder, urinary bladder, and uterus. And in terms of function, constriction of blood vessels and airways, pushing or food through the gastrointestinal system, and contracting urinary bladder and gallbladder, all really important roles there as well. Next up, we have nervous tissue. So nervous tissue is composed of only two principal kinds of cells. We have neurons, and we have neuroglia. So neurons are the nerve cells, and the neuroglia are structures that actually protect or support. Most neurons consist of a cell body and two types of processes called dendrites and axons. Neurons are sensitive to stimulus. They convert stimulus into impulses, and those impulses are actually conveyed to other neurons, to muscle fibers, perhaps to glands to allow them to kind of secrete their product. Neuroglia protect and support neurons and are often the sites of tumors of the nervous system. Again, for those who like to have a little bit more of a visual type of look at things, here's a link you'd find in the static images. So here, in terms of nervous tissue, it is throughout the body, made up of two important elements, the nerve cell itself and the supporting structures. And again, they allow for the conduction of stimulus. It receives messages about stimulus. It converts that into impulses, which are referred to as action potentials. Nerve impulses are conducted to other parts of the body, including neurons, muscle fibers, and glands. And on the image to the right, that's a really nice depiction of what nervous tissue should look like. In terms of excitable cells, a couple of things to note here. Now, they're called excitable cells because they carry electrical signals. Neurons and muscle cells respond to neurotransmitters which cause the cell to generate the signals. So, pretty important kind of role with respect to that. Coming towards the end of these slides, we can talk a little bit about restoring homeostasis and tissue repair. Tissue repair is the process that replaces worn out, damaged, or dead cells. Each of the 4 classes of tissue have a different capacity to replenish cells. So, for example, epithelial tissue is replaced by the division of stem cells or by division of undifferentiated cells. Muscle cells have a poor capacity for renewal. Nervous tissue has a poor capacity for renewal. Fibrosis is the process of scar formation. And if an injury is extensive, granulation tissue is formed. And granulation tissue is a different type of tissue than one that is normally present. So that's important to us for a couple of different reasons. One of the things you'll hear talked about in the course is adhesions. So sometimes adhesions are formed from scar tissue, and it can join adhesion tissues together, but it is of a different quality than the other tissue that's been around. With respect to tissue repair, another couple of things to kind of keep in mind. Nutrition is really important with respect to tissue repair. So having a good a balanced diet is important, as is the inclusion of various vitamins. And proper blood circulation is essential for good tissue repair as well. In terms of aging and tissues, a couple of things to make note of. Young people's tissues repair rapidly and efficiently. That process of tissue repair becomes a little bit more difficult as we age. A couple of reasons for that. Certainly younger bodies have a better nutritional status, better blood supply, and the metabolism is much more faster in those that are younger. Aging slows the process of tissue repair, so as you age, it takes a little bit longer to heal. Aging also results in stiffening and loss of elasticity in some tissues, and that's of importance in a number of different conditions and pathologies. In terms of homeostatic imbalances, disorders of the epithelial tissues are mainly specific to individual organs, so things like skin cancer, which involves the epidermis, or peptic ulcer disease, which involves the epithelial lining of the stomach or small intestine. The most prevalent disorders of connective tissue are autoimmune disorders, which are diseases in which antibodies produced by the immune system fail to distinguish between the body and what is foreign and potentially damaging. So essentially the body starts to attack itself. A good example of that would be lupus, which is also known as systemic lupus erythematosus. It's a chronic inflammatory disease affecting the connective tissue, and it's quite likely you might see some folk with lupus in your practice. And of course, there's other disorders that you might see involving the muscular and nervous tissues, and we'll look at those as we progress through the program itself. So that's it for our screencast today. Just a quick, short overview of the content for the week. In class on Wednesday, please bring any comments or questions. We'll have an opportunity to, again, go through the content. And then I have a particular activity that I want to have us go through in small groups, which is involves the preparation for the midterm exam. And I'll be able to talk about the midterm exam in more detail on Wednesday as well. That's it for now. Thank you very much. Be safe. And if you have a chance, get outdoors today and have some fun.